Our next speaker, Judy Pryce, is passionate about accessible, sustainable, and affordable health care. Judy is described as an activated member of the Patient Voices Network. She lives with chronic pain and has direct personal experience with children's mental health and care of frail elderly persons. She serves as a board director for the Victoria Foundation and Pain BC. Judy, welcome.
I'd like to introduce you to some of my family. This is my mom, Margaret, a frail 88-year-old with Alzheimer's. Me and my sister, who both have chronic pain, and my daughter, Megan, who lives with autism and faces mental health challenges. I'm going to describe some of our journeys within the healthcare system. My hope for healthcare is that we broaden the scope about what we think about when we think about healthcare. Healthcare can't do the job alone. We need to link the healthcare system to the community. By building smart and caring communities, we can extend our resources. When Megan was small, we had early indications that she was different. Starting in preschool, teachers started asking for testing, and we weren't surprised with the results. Wonderfully gifted, of course, but a bit quirky, and she got quirkier. At age 11, she was diagnosed with autism, with a high risk for mental health issues. But with the diagnosis came access to resources, funding, assistance in navigating the system, peer groups, and great support from Megan's school. And we're so grateful for this. Over time, Megan learned many coping techniques, but I worry about the kids that don't get the support. Although there were bumps along the way, including hospitalization, Megan graduated with honors from high school and was accepted to Emily Carr University. She moved to Vancouver, and her healthcare providers were careful to transition her care here. I was so proud of her for living independently and doing so well in her first year away from home. But during final exams last spring, Megan became stressed. At high school, students and staff knew what to do if Megan showed signs of stress, but for many reasons, the university did not know. Their response was risk-averse, 911, emergency, the works. When they found out about Megan's history, they forced her to take an involuntary medical leave for 18 months with no appeal and no support. This was our first taste of stigma that so many others have to live with every day, and we were shocked. Luckily, our family is outspoken, and faced with strong arguments, the university allowed her to return to second-year animation, and she's thriving there. Megan didn't need expensive critical care intervention. She needed some smart and caring communities. The university is learning from this and is now looking to build supports for students like Megan, and in doing so, it will save trips to the emergency. Did you know that exercise is dangerous? Here's my mom at age 80, hit by a car on her way to yoga class. We didn't think she'd make it, but after months of ICU and hospital, she was discharged and placed in residential care. Recently, she collapsed and was sent back to ER, and they revived her with heroic measures, and we are thankful. But now, even though smiling here, my mom lives with a very diminished quality of life. I think about how much the system has invested in keeping her alive near end of life, and I contrast this with how little the system invests in kids like Megan early on in life. On my way home from writing my final exams as a chartered accountant, I was in a nasty car accident. Unable to work for almost a year due to injuries, I tried every approach recommended and more, but the pain persisted. Insurance companies called me a malingerer, and I was humiliated. My boss only wanted me to back to work if I could work full-time. Eager to return to work and start my career, I found a new job that was more accommodating. This motivated me to work harder, so I did. And I've lived with chronic pain for over 20 years. Here's me malingering. My husband, Greg, and my exercise partner, Ian, watch out for me and provide support and motivation. I took the UVic pain self-management course, which taught me pacing and allowed me to meet others living with chronic pain. These caring connections helped me with my self-care, and I now have pain-free days. My hope for healthcare is that it's affordable. Healthcare budgets are huge but under pressure. The pie is limited, yet there are so many of us that need help. Maybe if we broke down the silos and integrated with community partners, it would increase the pie. My hope for healthcare is that it's available and accessible to those in need. For my daughter Megan, it took until age 11 for us to get the help she needed. Yet we were lucky because so many children and adults too do not get the help they need. 1 in 4 of us experience mental health conditions. For my mom, the hospital system was there in spades. The system's ability to react to crisis is amazing. But what about those in gradual decline? Will they have access? In 20 years, 1 in 4 of us will be over 65. And I, like 1 in 4 people, live with chronic pain. My hope is that healthcare incorporates innovative solutions. We need to quickly translate innovation and ideas into practice, be brave and take risks, make some hard but compassionate decisions about resource allocation, and spend less on heroics and more on prevention and self-management. My hope is that healthcare is delivered in smart and caring communities. Our Governor General challenged community foundations with a vision for a smart and caring nation. In my hometown, the Victoria Foundation has responded. Examples include funds directed to prevent childhood obesity and a physical literacy program for youth. My hope for healthcare is that we broaden the scope about what we think about when we think about healthcare. Healthcare can't do the job alone. We need to break down the silos and link the healthcare system to the community. By building smart and caring communities, we can extend our resources. My hope for healthcare is that my family can be healthy and happy with a great quality of life. And I hope the same thing for you and your families and your communities too. Thank you.